School psychologist versus BCBA versus clinical psychologist. Here's some things to consider. And this video is not all-encompassing. Just know that each of these roles can be diverse and the duties can differ depending on the state you're in, the type of clinic, the type of school, etc. One of the main roles of school psychologists in this country at this time is that school psychologists conduct psychoeducational evaluations to determine whether students meet criteria for special education services or additional services in schools based on if they have a disability. One of 13 disabilities that is recognized by the Individuals with Disabilities Education Act, or IDEA. Depending on your school district, you might have a heavier testing or student caseload. Some other school psychologists, if the ratios are a little bit better, and that's where the field is hoping to end up, they might be able to do other clinical duties like running social skills group with students or doing short-term therapy or helping teachers with behavioral management strategies, etc. School psychologists say that they do assessment and they love data. It's because we are often the people who are looking at the numbers, trying to solve puzzles, determining what a student's specific needs are so that we can maximize their academic, mental health, behavior. Versus BCBA, so BCBA's in and outside of school districts, their primary focus, although they do assessment, but the primary focus is to plan and structure interventions that are meant to modify challenging behaviors or to enhance strengths and different positive behaviors that we want to see more of in the students that we support. BCBAs in school districts also support teachers in how they approach their behavioral programming with students. So that's also something, if you're interested in being able to support teachers with behavioral management or making sure that their classroom is running smoothly if there are any particular behavioral challenges. To become a school psychologist or a BCBA, it's a master's level minimum degree. However, there are PhDs in school psychology and applied behavior analysis, ABA. Those might open some more doors, especially if you are interested in opening up your own ABA practice or opening up your own private practice as a school psychologist. However, school psychologist master's levels, you can become a licensed educational psychologist or LEP or whatever your state's equivalent might be. However, I think that there's only like less than 10 states in the US where you can do that. In other words, where you can practice outside of the school setting. And BCBAs outside of school districts, so BCBAs that are community-based BCBAs, often also plan for interventions. However, a lot of these therapies are taking place in community settings, for example, like your clients' homes. So supporting clients in their daily behavioral tasks to enhance their overall quality of life and independence. Lastly, clinical psychologists are pretty hard to define. It's kind of like asking, what do physicians do? Well, some physicians are surgeons, some physicians are podiatrists, some physicians are developmental behavioral pediatricians, etc. So there are different specialty areas and you kind of find your niche. Out of these three tracks, to become a clinical psychologist, it takes the longest time to do that, and it tends to pay the best out of these three paths as well. During your time in your doctorate program, which might be in clinical counseling or school psychology, you hone in on your craft, you figure out along the way what populations you want to serve. So whether that be adults who are experiencing challenges with using illicit substances, or if it's working with trying to engage in suicide prevention with the elderly, or if it's working like I do, doing testing with children, adolescents, and young adults. So you figure out along the way what it is exactly that you want to do. And so that's something to consider as well. Traditionally, school psychologists mainly focus on children and adolescents. Versus clinical psychologists, they tend to prepare you to work across the age span, but then it's up to you to determine, okay, what is the specialty I want to identify with? And throughout your doctorate program, you'll participate in practicum, internship, fellowships to specialize even further, get your training up, and boost up your skills in serving that population. I don't have a favorite one of these three. That's why I'm all three.